You have found this page because you or someone you know is suffering with a bulging, herniated, or degenerative disc and are experiencing back or neck pain, sciatica, pain down your arm or leg, or numbness and tingling. You may have tried numerous drugs, chiropractic, physical or massage therapy, dangerous spinal injections, or maybe even spinal surgery, just to discover it didn't work. The problem is that those treatments don't create healthier discs. It's that simple. Please listen closely. A symptom, according to Webster's dictionary, is something that indicates the existence of something else. It's like the dashboard of your car. If the check engine light comes on, it means that there is something wrong with your engine. There is no problem with the light itself. It's just telling you that there is a problem that needs to be fixed. You can put a piece of duct tape over the light or even remove the dashboard and do surgery to cut the wires that are keeping the light on, but it will not fix the problem. If you ignore the light, your car will eventually not work since you are neglecting the problem. One of the major distinctions in my office is that we don't treat symptoms, nor do we treat conditions. We create a treatment plan for you to address the underlying problem in your disc that is causing your pain and symptoms. Now let's talk about the anatomy of the spinal disc. The healthy spinal disc is 86% water and needs water, oxygen, and nutrients to continue to survive. A unique feature of the spinal disc is that it is avascular, which is a fancy word that means it does not have a direct blood supply. The only way it gets the water, oxygen, and nutrients, the circulation, that it needs to survive is via a very specific mechanism called the pump mechanism of disc nutrition. This mechanism works as we move and works like a pump. If you injure the disc, the pump mechanism does not work properly, and over time will cause bulging, herniated, and degenerative discs and possibly spinal stenosis. So the main problem causing your pain and symptoms is the failure of the pump mechanism. Now, let's say we have a generic water pump providing water, aka circulation, to a plant. If one day that pump fails, it will cause a decrease in circulation to that plant. Well, what happens to any type of tissue, whether it be plant, animal, or human tissue, if it loses circulation? Exactly. It will cause the tissue to become weak and eventually die. This is exactly what is happening in your spinal discs. The pump mechanisms are no longer working and needs circulation to be able to heal and repair. The treatment that we provide in our office will fix your pump mechanism that is not present in your injured spinal discs. So you have a decision to make here. You can either continue to treat the symptoms of your serious spinal discs, which has not worked up to this point, or you can finally do something to fix the underlying cause of your disc problem. Put your email into the box on this page, and we will email you a report on this treatment right away.